So, what is existential psychotherapy? I get this question a lot, which makes sense. I'm an existential therapist. But even from other therapists, right? They question, what is that? How do you do it? What does it look like in the therapy room? I think a lot of graduate school programs don't really do existential psychotherapy justice. And a lot of the times, it starts with a lot of dense reading, right? Philosophy, because existential psychotherapy bears its roots from philosophy and philosophical thought and inquiry. And that could be really dense and boring. Philosophers are making up their own language and words to describe some of these human experiences. And so I think it makes it really unattainable or inaccessible for an early career therapist or student wanting to learn how to help someone, right? Like, I can't help someone if I don't even know what some of these words mean. But in a nutshell, I think existential therapy is one of the most accessible or attainable forms, if you can even call it a form of therapy, because it deals with human um, suffering. Maybe that's a bad word here, but the givens or the realities of being human, right? The fact that we are aging, the fact that we are going to die, the fact that we can live very lonely existences, like we're the only ones in our own heads, depending on who you ask. The fact that we have to create our sense of meaning if we even want to do that, right? But we're like faced with the reality that we are going to have to choose. Themes regarding like good and evil. What does that mean, right? So existential psychotherapy focuses very much on these realities of being human. And I think for a therapist, especially early on, who's learning how to help someone really, um, we're wanting a manual, right? We're wanting, hey, when someone comes into the office complaining or, talking about this, what's the tool? What do I give them? What do I tell them? How do I make them feel better? But existential psychotherapy leans into some of those scary realities of being human and doesn't offer a manual or a coping skill or tool. It doesn't necessarily give someone anything outside of more inquiry and curiosity so that a person can kind of come up with their own answers. And that's very much a belief system that I hold. I think that anyone who comes into the therapy space has their own answers or holds their own answers, and that it's up to the therapist and this collaborative space and inquiry and phenomenology and Socratic dialogue for us to be able to assist a person in finding or creating their own answers. And that really kind of in a nutshell is what existential psychotherapy is. It's a non-manualized, non-prescriptive, non-performative, very relational, collaborative dialogue that allows a person to better understand themselves, especially when it comes in the context of what it means to be a human being and all these givens that come with being a human.